Tom Fletcher, who, as you know, is the Emergency Relief Coordinator and head of the Office of the Coordination of Humanitarian.
So here is what we plan to deliver in the first 60 days of the ceasefire. We will aim to increase the pipeline of supplies to hundreds of trucks every day. Food, we will scale up the provision of food across Gaza to reach 2.1 million people who need food aid and around 500,000 people who need nutrition. Famine must be reverted in areas where it has taken hold and prevented in others. We'll be providing cash for 200,000 families to cover basic food needs and bolster their ability to cope, and also to give them their sense of, and this is so important, dignity and agency by choosing their own food from the markets. We'll restore the decimated health system. We'll aim to deliver more essential medical commodities and medical supplies. We'll aim to re-establish community-level disease surveillance, to support emergency referrals and more medical evacuations, to supplement the workforce by deploying more emergency teams, and will help scale up emergency care, primary health, child health, sexual, reproductive, maternal and neonatal health, non-communicable diseases, mental health and rehabilitation. We will now carry out a massive scale-up in shelter provision, including to help families to prepare for winter. We'll bring in and distribute thousands of tents every week, in addition to tarps and other items. We'll focus on bigger and more vulnerable families and those in particularly dire conditions, in underserved and overcrowded sites. There must be no backsliding on the agreements that have been made. There will be some who will seek to prevent President Trump's plan from being implemented, and that must not be allowed to happen. This cannot be a false dawn for civilians in Gaza and Israel who are so desperate for peace.